All right, folks, I am joined by Dr. David Rabin, a cardiologist at Salem Hospital. Thanks for taking the time to join me today, David.
No problem at all. No problem at all. You can see
So,
I'm home.
yeah, enjoying yourself. But in all seriousness, so you are on the front line of this pandemic. Can you tell us sort of how your life has changed in the last week or so, and are hospitals ready?
Sure. Well, I'm a cardiologist. Our practice has totally changed. We are restricting people coming into the hospital. A lot of us are working from home, as you can see. As far as patient contact goes in my office, I'm doing a lot of what are called virtual visits, where I'm actually calling patients on the phone and just going through how they're doing, making sure they're taking their meds okay, if there's any interventions I need to make. I try to do it. Again, our patients are cardiovascular patients, and these patients are at high risk for complications from COVID-19. So whatever I do, I can't, in good conscience, bring them to the hospital. So we've really cut back on testing. We've cut back on all kinds of things. So in terms of our outpatient work, it's really drastically changed. And as far as the hospital itself goes, we've made some changes too. We've minimized the number of people that are going to the hospital. We have a system where we have 3 doctors in the hospital, and they are it. They're the only people seeing patients in the hospital, and we rotate on a schedule that's been put out months in advance. So that's pretty much set. The hospital is in the process of putting together a surge protocol, surge plan, and I'll actually learn more about that tomorrow, but I've been talking with some of the hospitalists and the intensivists. As you may know, most hospitals now are run by hospitalists. These are inpatient doctors that take care of you when you go into the hospital. Your primary care doctor rarely, if ever, goes to the hospital. So these are really the doctors that are on the front lines. These are the people that are seeing a lot of the people come into the hospital. And at least at Salem Hospital, we've divided the hospital up. There are a couple of floors that are now pretty much COVID-19 floors. And those are the only patients that are on those floors. Some of those rooms that are for the patients that are COVID positive, they're what we call negative pressure rooms, where the air is actually sucked into the room and ventilated out another filter, as opposed to a normal room where you just open the door and the air exchanges with the corridor. And these rooms theoretically cut down on cross contamination. So these patients are all in negative pressure rooms. And at least at this point, we haven't hit the surge. I think from the last time I heard, there are only 4 COVID positive patients in Salem Hospital with about 30 suspected. But the trajectory is mind-boggling, and what the planned surge could be in the Boston area, up to thousands and thousands and thousands of patients admitted to the hospital, and then a fair percentage of them requiring critical care. So it is not a benign problem. And we've got a tiered system where we have intensivists at the top of the pyramid. These are critical care physicians, pulmonologists, some anesthesiologists, and they will be supervising teams made up of some hand-picked hospitalists, maybe some other anesthesiologists who also are skilled with ventilatory management, because these patients that are critically ill need very careful ventilation management due to the damage that the lungs feel from COVID-19. So we have intensivists, we have anesthesiologists, we have hospitalists, and residents, because Salem has medical residents, so some of them will be involved. As cardiologists, we may be partially consulting on some of these patients, because these patients may develop hypotension, their blood pressure drops, there are cardiac complications around COVID-19, so there are specialized medicines that we administer intravenously, and we manage those kinds of drips a lot, so we may be called in to help with those patients. And also, when the hospitalists are pulled off of the general hospital service, their ranks are going to be thinned. And so there are patients right now that we just merely consult on, patients with arrhythmias or chest pain or whatever, and we may wind up managing them ourselves and having them on our service. So there's going to be a lot of changes, at least at Salem Hospital, in terms of the infrastructure and caring for not only the COVID-19 patients, but for all patients, because patients still get sick. There are going to be other patients coming in, heart failure, arrhythmia, et cetera, that we all have to take care of while we're taking care of those other patients.
Well, and let me ask you this, David. How are you preparing yourself for this onslaught, this new rush that we're expecting?
For one thing, I shaved. I used to have a goatee, and there's a couple of different kinds of masks. There's the regular surgical mask, but then there's the N95 masks, and anybody with any kind of facial hair, you can't wear those because you don't get a good fit. So just a pure housekeeping detail. If you do have facial hair and you're going to be on the front lines, you can't have it because you can't wear those masks. I bought some scrubs, so I'm going to be changing just because what I bring in the house, I don't want to bring in any coronavirus. Our offices are stacked with Purell and masks. We're masking now. There's universal masking. So those are the kinds of things that I can do, both as just for my wife and my home, as well as my patients.
And is there anything that you can convey to the public now to help them, as we're hearing, like flatten the curve or make your life somewhat easier?
I think follow the instructions that you've seen. It can't be overstated that this sort of shelter in place, minimize your contacts outside, stay away from crowds, scrupulous hand washing. There is something to be said about wearing a bandana, any kind of thing that blocks part of like large droplets. So you'll see more people wearing masks or bandanas or anything. Any little bit will help, but that's basically, it's just for what people can do at home. It's just what's been out there. Social, I hate to say social distancing, but certainly physical distancing, scrupulous hand washing. That's about the best you can do.
Well, we really appreciate you taking some time to talk. And maybe, hopefully, we'll see if you have a time in there down the road. We can catch up and chat again.
I give you a perspective on what happens, because the surge they don't predict will hit here for a few weeks. We're a little behind. So hopefully we're going to be seeing that surge in 2 to 3 weeks.
Okay. Well, thank you, Dr. Rabin. I really appreciate it.
Take care, Corey. Thank you.
Be
Bye-bye.
well.
You too.